Take Your Medicine. On today's show, we will talk about the different types of eye drops and how to use an eye drop correctly. Eye drops can be used to treat minor eye ailments and eye discomfort. Many eye ailments can be treated by using over-the-counter purchased medication, especially for dry eye or acute allergic irritations. Irritation caused by chronic conditions may be needed to be treated with prescription eye drops recommended by an ophthalmologist or an optometrist. So let's look at the different conditions to treat the eye. Firstly, we look at dry eye. Eye irritation and dry eye is common especially in autumn or winter. Most minor cases of dryness respond well to lubricating drops or artificial tears. But these drops may not alleviate the symptoms completely. Some patients using medication to treat chronic conditions such as hypertension and chronic sinusitis, the medication may cause dry eye symptoms. So it's best to check with your doctor if your medication is not causing chronic dry eye symptoms. The next condition is red eye or redness of the eye. This is usually caused by an allergic reaction to an allergen or also from removing a foreign body from the eye. Decongestant eye drops can help clear away the redness by constricting blood vessels in the eye. If redness persists, then you should contact your doctor. Next, we look at allergies that affect the eye. Allergens like grass, dust, pet dander, mold, or spores can cause the body to release histamine that trigger eye irritation, redness, and watering of the eye. Over-the-counter and prescription eye drops that contain antihistamines can block the histamine that initiates the allergic response. We now look at antibiotic drops. Antibiotic eye drops help for bacterial infections. Bacterial infections like bacterial conjunctivitis or pink eye may require prescription eye drops to kill off the invading infection. Antibiotic drops are also used to prevent eye infection after eye surgery. The next eye drop we'll look at are rewetting drops. Contact lens wearers can get relief using over-the-counter rewetting drops to add moisture when contact lens feel dry. And lastly, we look at drops used to treat glaucoma. Glaucoma is a condition where there is an increase in intraocular pressure within the eye. This increase in eye pressure can cause loss of vision and damage to the eye. The purpose of these drops is to maintain a safe level of internal eye pressure. The eye drops to treat glaucoma is prescribed by a doctor or ophthalmologist. These are the most commonly used conditions that are treated by eye drops. Now we will look at the correct technique to instill an eye drop into the eye. Firstly, tilt your head back slightly and look up. Then use one hand to pull the lower eyelid down, away from the eye. Hold the dropper tip directly over the eyelid pocket and then gently squeeze the bottle and let the eye drop fall into the pocket. Don't touch the bottle to your eye or eyelid, as this can give the bacteria or other contaminants a chance to grow in the eye drop. Close your eye and do not blink. You can massage the tear duct to help disperse the eye drops better. I hope that today's episode was informative, and if you enjoyed today's show, then please hit the like button and subscribe to the channel. Thank you guys for joining me. Take care. Goodbye.